I'm sure that I know that some of you are already running kitty kata and everything. You're already seeing everything that is going on everywhere. UK recruiting health assistants, this one, that one, plus bus. I have like a couple of 2 or 3 or 4 or 5 or 7 or 10 videos in my YouTube channel. Yeah, on this channel you can actually watch for how to apply eligibility requirements and everything, and then agencies that required verified agencies, step by step how to require, how to apply. I'll put in the link in the description box. Like if you actually check the requirements, most times they say no experience required and everything, but if you know, as I said in my video, they can say no experience, but really if they see somebody that has experience, they can actually choose the person over you. So your best bet is always better to have this experience. So guys, welcome back to my YouTube channel. This is okay, I should tell you. Of course you're watching Jamba with I should tell me, so I share about immigration, travel, everything. It's the bus. Yeah, please make sure to click the subscribe button, subscribe to my YouTube channel. So before no further ado, anyways, disclaimer, I am not an agent, I am not an immigration, I don't have any link with them or anything. Whatever I share is based on my past experience, my opinion, my research, my thinking, my everything. So make sure any information I give you, make sure to still verify with the immigration officer, the immigration office. This is just like me giving you what I think. You understand? I hope you understand. So now let's dive right into it. If you see me looking at my book, I've actually written them down, and see, I don't want to make any mistake. So the first on our list is the experience you've had but you did not know you've had that will actually be useful for your healthcare experience is here for the sick. There might be a point in our life, in fact almost every one of us is actually in a point of our life cared for a sick person, but it's either a long-term sickness or a short-time sickness. So if you know you have a aged grandmother, a sick father, a sick mother, a sick uncle, a sick anything, you have your experience right there in front of you. What are you looking for, my dear sister, my dear brother? Let's say you have like an aged parent, or maybe your dad, one of your parents, yeah, maybe your dad is suffering from stroke, or your mom is suffering from dementia. Guys, it's not an insult, or anything can happen to anybody. I have a special need girl in my family. So I'm just trying to say, just in case you have anybody in your family that requires a special need, maybe even your family you have a special need child, a special need sister, a special need brother, a special, just anybody that needs special need medical attention, and you've been doing it for a long period of time, like somebody that as somebody that has stroke, you know, they can't do things on their own, you have to support them, you have to do this. Or somebody that maybe the parent, one of the parents or the uncle is actually depressed, and then you have to constantly stay with him or her to make them happy, to make them this, to make them that, or maybe just like emotional support or something. That is an experience right there. It's an experience, and you actually did this. So include it in your SOP. And if you can even want to be elaborate, if you are not trying to like be secretive, you can actually even provide medical medical certificate to actually prove your point. So just imagine you have an uncle that suffers stroke, and you were with him for the past 5 years, 6 years. You've been the one supporting him to take him to the toilet, supporting him to eat, supporting him to this or this one. It is an experience. Add it to your SOP. It is in fact a very good, very experience. So even when you're stating it in your SOP, you will talk about some of those symptoms of those stroke, or some of the things that you did aside this general one that I'm saying, that some of those peculiarities to that illness. Okay, if you're an old parents, like, you know, most times when grandmas and this thing, they really cannot remember things, they can't move things themselves and everything. Say those things you did. Say those things you did. You played music for them to make them happy. You stayed with them. You did this. Say it. That is exactly what they're looking for. Care workers, support workers. That's the care you need. That's the experience you need. So imagine when you're actually trying to apply for a care home, that just like the one I did in my previous video, how to get verified agency. There was one we saw in one of those websites. They actually need a support worker for an elderly person. Yeah, for an elderly, is he a man, a 70-year-old man that just need they need a carer or a support worker for the person. So something in that type of, come watch the video. In that type of scenario, you can send your CV and say you used to have a parent, an age parent of this age. You can even increase and say 85. I'm not saying you should lie. You say what you see. 85 that suffer from stroke, that suffer from kidney. You were the only one that was there for him. You supported them to the bedroom. Say everything you say in a normal, plain, and more professional English. Hope you understand what I'm trying to say. So that's that experience that you have, and you did not know that you have it. Are you guys saying? So the experience is just there. And funny thing is, no matter the experience you have in your home country, when you get to UK and everything, they will still teach you what they want you to do, because healthcare system in Nigeria is different from UK, is different from Ghana. They will still teach you what to do. So all they need is to have the experience, you have an idea of what you're coming from. Not like when you actually get to UK, you start saying, this is not what I bargain for, I cannot do this, you run away and everything. They just want you to have an idea, to be sure that this is what you're coming from. Are you sure of yourself? Something like that. So you've had your experience, just develop it in a professional English, package it, support it with evidence. You can even support it with pictures. You can even support it with, like, if you're someone, in fact, in Canada, to apply for nursing, it's something like this that they need. They will ask you what inspires you to want to be a nursing. You can support it with pictures. If you really did it, pictures and everything, like, that's what they need. You can say that's what has actually now inspired you to actually be an healthcare worker, because you know how tormenting it can be for their family members and everything. You can say that is your reason. That is something, is it not? So the first on our list is the experience you've had, but you did not know you've had, that will actually be useful for your healthcare experience, is you've actually worked in a hospital setting before. You've actually worked in the hospital setting before. You could be a driver, you could be a cleaner, you could be I don't know, I'm trying to look for the most non-medical work to do in the hospital. You could even be a gateman, you could be anything, you could even be selling food, anything. You have sure worked, you were sure present in a hospital setting for a long time. For this, you basically, even when somebody asks you something, you can actually like tell something, you can say something. You see them transport sick person, you see them done this. Especially cleaners, you've helped the patient. Even maybe when you go to clean the patient's ward, you can help them to sit also. You've actually done something in the ward, like different things depending on the private hospital, government hospital. You shall worked in the hospital. You could even be a receptionist in the hospital. In fact, you could be a secretary. Which other this I'm trying to, as long as you just stayed in the hospital, not like you were sick. If you've just stayed there in the hospital for a period of 1 month, 2 months, 3 months, anything, you already have your experience. You already have your experience. All you need to do is tailor it in your is this statement of purpose? Yeah. You understand what I'm saying? That's actually an experience. You've worked in the hospital settings before, and you had experience with maybe the old people ward is called clinic or something. You could even be in the mental ward, you could be in the neonatal ward, it could be in the anything. So wherever you've worked, even if you worked as a driver, even as a driver in the hospital, maybe you drive ambulance. Of course, if you want to drive an ambulance, sometimes you help the patient to even come outside, to go inside. You've seen things with your eyes, yes or no? You've seen things with your house. Sometimes you can just be like normal driver. You see them doing first aid for a dying patient or this thing. You just be looking. Yes, it's an experience. It is an experience. It doesn't have to be like you've touched it or not. You saw it with your eyes. Even me, that I feel like a medical student, as a driver in the hospital, you can still tell me so many medical procedures. You can tell me how to care for a sick person, how to care for a mental person, how to care, because you've seen them do it. Though you've not done it personally with your hand, with yourself, but you saw them do it. It's an experience. And what they say, experience is the best teacher. So what are you wasting this experience for? Include it in your CV. Use it in your SOP. You're a driver for this one, you're a secretary in a hospital, you work in social hospital, you've seen them transport patients, you've seen them do this one. The things you saw, say it there. Though people feel like and what you say is different from what you do or what you do, but at least you've seen it, you know how it is, you've worked in that settings before, so you're actually qualified. That's the one experience that you need and you do not know. You're qualified. Yes, So the next on our list is nurses, care workers, normal nurses, nurses, diploma nursing, skill of nursing, this one, that one. So if you know you have diploma in nursing, BS in nursing, and there are some people that just went to school of nursing and maybe they just feel like the country is not promising, they just abandoned it and pursued another career and everything. You're qualified, you have your certificate, though you did not practice, but it will actually still give you an edge. Sort of, you can actually still apply. Pity, that's still an experience. Look at me. Then the last but not the least is actually similar to number one, but this one is internship. There's some people that they did their internship in the hospital. For example, maybe you studied MLS, you studied pharmacy, you studied I'm trying to see even microbiology, you studied there's some courses that are not too medical, but you sure did your internship in the hospital, and then you're telling me you don't have experience. Okay, you have experience. That's it right there. That's your experience in front of you. That's just it. That's it. So choose it. So far, this brings us to the end of today's video, and of course, if you enjoyed this video, make sure you click the subscribe button, subscribe to my YouTube channel, and I'll see you in my very next video. Thanks for watching, and bye.